joining Leah and Stephen. I'm gonna give it another couple of minutes before we start. We are hoping to have a discussion by Catherine Carroll, and I don't see her. She's not here in the room yet, and I don't see her online yet, so I want to give her at least another couple minutes before we start.
Okay.
All right, let's go ahead and get started. We'll just go through our agenda and come back to Catherine when she arrives. So let's start with introductions. Also, just to make sure this is the quarterly meeting of the Human Services Transportation Advisory Committee from the Capital Region Transportation Council. Angelina, if we start with you.
Angelina Searles, I'm the director with the Town of Colony Senior Resources Department.
Judy DeHoda Taylor, the Deputy Director of Sargent County Office for the AG.
Mark Castiglione with the Regional Planning Commission.
My name is Carrie Ward, staff at the Capital Region Transportation Council.
Martin Paul, I'm also at the Transportation Council and Director of Regional Planning.
I'm William Fitzgerald with the New York State Department of Transportation, Region 1 Planning and Programming.
Matty Simone, also with New York State DOT Region 1 Planning and Programming.
Thanks, and I just want to add a little, because I think this group is used to working with the main office, Public Transit Bureau. But when we do the reviews for like the 5310 grants at least, so I'll review those, and somebody from Region 1 is usually partnering with me and reviewing those as well. I'm not sure if you review the 5311.
I'm kind of just an observing capacity today, but
Yeah, I mean, Audrey, will happily look over them, and either I or Audrey will do that. Yeah.
So that's kind of the tie-in with the regional office and the main office from the transit side of things. And so moving online, Adam.
Yes, Adam McCarville. I'm a transportation planner for the Transportation Council.
And Leah.
Hi, everyone. I'm the administrative specialist at the Transportation Council. My name's Leah Rye.
Oh.
I'm Steve Perino. I'm with the Public Transportation Bureau at NEXA.
Oh, great. Thanks, Steve. And Michelle.
Hi, I'm Michelle Abel, Associate Executive Director at Catholic Charities Tri-County Services. Our staff person, Adam Leach, is out on vacation today.
Great, thank you for joining. So the first thing I had on the agenda was the acceptance of the meeting notes. You should have received those in your email. Should be sharing them now. The attendance and then what we discussed. So I do send these out via email, and we used to approve them at the meeting. However, we have to submit them now, like sooner than 3 months after the meeting. So if you ever see something in there that's not correct, when I send them out, just let me know like ASAP, and then I'll make the change and I'll re-upload it, because it's usually already been uploaded to the website, but I can make changes and, re-upload it to the website. So those are the meeting minutes. The next thing on the agenda was, Katie Carroll, was planning to join us today I had asked her if she could talk about the impact of the, federal policy and funding changes, specifically on human services for people with disabilities. She said she hadn't looked specifically into transportation as much per se, but she had looked a lot at just the overall landscape on the impact on the provision of human services, specifically for people with disabilities, and maybe not as much for the senior populations. So anyways, that's what we may be able to look forward to. The next two things on the agenda, the last round of 5311 formula grant funding, the applications were due, I believe, in February of 25, and the last update I had on that was what I said at the last meeting that we had was if the awards were expected in June. Stephen, do you happen to have any update on the status of that?
For that, I haven't been made aware of any delays necessarily, like anything specifically holding it up. So I think it's just, it's just slow with the process of awarding them. But I think my estimate would be within the next, month or two, would probably be the closest, estimate I could give for that.
So there's nothing in particular holding them up?
No, there's nothing, that's a significant issue there.
Okay. And then as far as I have heard, the next solicitation for the 5310, which is the enhanced mobility of seniors and individuals with disabilities. The application process would be expected out this fall. Does that still sound accurate?
Yeah, that's correct. That's what we're aiming for fall.
So that's, I think, helpful for us to know. Okay, the next thing I have here is I put a link in the agenda to the Most Integrated Setting Coordinating Council. I think the meeting, they tend to meet quarterly. The last one was the recent one was canceled anyways. But the next planned meeting is September 12th from 1 to 3. So that's the effort where the state agencies meet with each other and trying to communicate about how best to, for people to live in the most integrated, people with disabilities to live in the most integrated setting possible, and talk about, state policies and how they may impact that. So Martin is new staff here. He's gonna be taking over this task for human services transportation. I'll probably you'll still be seeing me, but he relatively new, and I had asked him to look at the master plan for aging when Judy had sent it to me. So he's a lot more familiar with it than I am. So I asked him if he could just give a summary on what you saw in that.
Right, and I may be more familiar, but that doesn't mean I'm very familiar.
It was
So,
like
and-
800 pages.
It was a huge document, but very interesting. Basically, I guess most of you know that the Department of Health has put together a master plan for aging, basically responding to what was perceived as a siloed approach at the state level to services for the elderly or for aging people. Basically the way it was put together was by soliciting proposals from stakeholders and the public. And about 100 of those were chosen to actually be part of the plan. It's a tremendous, it's a tremendous undertaking. And you can find it online if you want to go into all the specific details of what those proposals are. But we do, I can just read off, they were divided into 9 different groups, 9 different categories or pillars as they were called. One was informal caregiver and workforce support and modernization of community-based network service. Modernization and financial stability of healthcare, residential facilities, and community-based aging network service providers. Prevention and wellness promotion, housing access and community development, affordability of basic necessities, access to services in and engagement with historically underserved communities, social engagement of older adults, combating elder abuse, ageism, ableism, and stigma, and finally, technology access and development. So what's interesting about the list, and which is extensive, is that transportation actually was not included as one of the pillars. So the plan covers you know, really broad cross section of needs, but maybe is not specifically directed at things that we do in this group. But nonetheless, I can send out the web address for that if anyone would like to read it, and you don't already have the address. It's probably.
Was there some sort of transportation subcommittee?
So,
that participated in?
Yeah, so there was a transportation subcommittee.
But it was not a standalone pillar.
Yeah, so you participated in the housing one, right? So the transportation, I think, was a subcommittee of that housing one. I don't know, it was a subcommittee of something.
There was a lot of subcommittee stuff.
Yeah, like I said, I haven't gone through every single proposal, so there might be something on transportation down there somewhere amongst, because there are, like I said, over 100 were selected and several hundred more were received.
And I know we did talk about technology in the transportation one. Obviously you can use technology sometimes instead of transportation, like you can order your meds online or whatever. But also technology of arranging rides or the use of technology in the provision of transportation. And so I think that might have gotten fed over to the transportation. There was the technology pillar as part of it as well.
Yeah, one of the things that was interesting to me, which I did not know, because we were talking about housing and community development, is that the Department of Health had it on as a key policy to support aging in place almost exclusively as the strategy to serve the older population. So some planners online said, wait a minute, that might not be the only solution, even though they want to live in an aging place, that might not be the most economical or viable solution to handle a growing aging population. So they moved off of that as the only solution, but mentioned a variety of things to facilitate aging in place, in addition to more housing choice, which was so long ago. That's pretty much the only thing I can remember.
There was
Years.
Yeah. Right. Thank you, Martin. The next thing I have on here is the Olmsted Plan update status, and I put on the agenda what would most improve the ability for people who have a disability to get where they need to go. And that was kind of just a thought thing, so we can come back to that in a minute. But in case you're not aware, the Olmsted Plan, the idea from that is to ensure that individuals with disabilities have meaningful opportunities to live, learn, work, and enjoy life in the most integrated settings appropriate to their needs. So they're working on an update to the Olmsted Plan. There is actually a transportation, whatever we say, committee as part of that. And I'm participating in that. So each of the committees is supposed to come up with at least one SMART goal, which stands for specific, measurable, achievable, relevant, and time bound. So we've met, we're meeting bi-weekly, and the current thing that we're looking at as a priority is somehow address stigma associated with using transit, and also to address or provide travel training. So there has been a lot of discussion about, providing more van kind of, specialized transportation services. I think there's an understanding though that that's really expensive. There's also been some discussion about people having a hard time walking where they need to go when they actually live really close or at some point in the day are close to services that they would otherwise be able to walk to. And given that this group is being led actually by somebody in the Department of Transportation, there may be an opportunity to work in something about funding priorities or the way scoring is done for things in relation to, repaving and sidewalk repair and that kind of thing. For DOT projects, that would be more like villages than cities. But I just, so what we're coming to, I think, because there's a concern that if you make it too aspiring of a goal, that it would be too expensive and then nothing would happen. That's why they're looking at, or we're looking at somehow addressing stigma associated with using transit, which could be fixed route transit or specialized transportation services, as well as travel training. So I'm definitely, that's a group that's, I don't know, there might be 20 people on the list, but in terms of who actually has been showing up to the meetings, it's more like 6 or 7. So I definitely, there's plenty of time for me to be able to insert this group's perspectives into that. And, so if you have thoughts on, from a disabilities perspective, what a good, specific, measurable, achievable, relevant, and time-bound transportation related goal could be, I'm happy to portray those ideas back to that group.
Just to clarify, and talking about trying to reduce the stigma behind it, so would that be some type of like educational program, or just like, is that kind of the intent of what the measurable thing would be? Is some type of like educational approach to the aging population, or like,
Yeah, I mean, I think we haven't talked about what kind of education. I think it is an education-based thing. I think sometimes stigma is coming from within and sometimes coming from without, right? So like the education could be for people who would use the transit, but it also could be for people who are making fun of the people who are using the transit, right? So we haven't really gotten into the detail in terms of what kind of education and who exactly it would be geared towards, but yes, I think the idea is education. Which could also be like different marketing materials for things.
When did the homestead plan program start?
What's up?
When did Olmsted start? That was a federal decision, wasn't it? And it was,
Yeah, it's,
what decade was it?
law.
we could Google that.
It's not new.
No, it's not new.
Okay. Keep thinking of the park designer.
Oh, yeah,
Yeah, different.
not that old.
Right,
Frederick Law Olmsted.
right.
1999,
Oh, wow, okay.
US Supreme Court case in 1999,
Guess that's
based on America with it was based on America with Disabilities Act.
Okay,
June 22nd, 1999, but specifically,
yeah,
if my AI is correct.
okay.
I can't believe everything it says. Yeah.
Just past.
So 1999, so 26 years ago.
yes, just to add, in terms of like something that's measurable. Just thinking, I guess, in terms of measuring, like, the perception of it, like, kind of what we talked about, like stigma between different groups using it versus like how many people actually get on it. I guess would
Yeah.
be something to consider, like, I guess depending on what the actionable item is and what direction it's going, whether it's, You know, because you can survey and ask people's opinion on it, but then seeing if more people are actually using it. Compared to, or, you know, something to measure with whatever you end up choosing to do, I think would be kind of
Yeah.
important to look at.
Thanks. Okay, so moving along, the next thing I have on the agenda is transition plans, which are our Americans with Disabilities Act. Transition plans for pedestrian infrastructure and the public right of ways is what we've been talking about. So there were links on the agenda, Rensselaer, Manans, Wilton, and Clifton Park. Since the last meeting, I believe, the town of Wilton the town board adopted theirs. The Village of Manans' public review period ended, and that it was on the village board agenda, I think it was March 17th. But it's back on tonight, so the board, you know, depending how they vote on it, but it's up for adoption at tonight's meeting of the village board. And then we should be starting the Albany County one soon, so that will be on Albany County roadways. So the sidewalks that exist on Albany County roadways. And we've done the RFP and, you know, the consultant selection already. We're waiting for a contract to be signed, and then we'll be training the county staff to do some of the data collection for their inventory collection. Any questions on those? Okay. Capital Region Vision Zero Safety Action Plan, there will be a virtual public meeting tomorrow. Forgot my press release. Tomorrow evening to discuss concepts for Green Island and Watervliet. It's gonna be a combined, you know, virtual public meeting. In Watervliet, in Green Island, we're looking at Lower Hudson Avenue. So like if you're coming out of Watervliet and going up towards the Green Island Bridge, and then we're not including the Green Island Bridge per se, but we are including that intersection, and then continuing north to where the road fees, and there's some village offices there. The senior center is on the left, I think, but there's housing on the right. And so there's, you know, they wanted a better way to cross the road. So we are looking at an additional crosswalk. Not exactly where they wanted it, because there was concerns about it being a mid-block there. So just a little bit further north where there was an intersection. So proposing, you know, a fuller round of the crosswalk at each leg of the intersection, basically. So that will also be incorporating some changes that I believe it's NISA is progressing for the Green Island Bridge that involves putting a widened sidewalk or a bike lane on the north side of the Green Island Bridge. And then in Watervliet, we're looking at the block that's kind of roughly bounded by Broadway, City Hall, and the library / senior center building, and then over to where the pool is, and then including the McDonald's, so south of where the post office is. So looking at formalizing some of the striped bike lane stuff that's over and by the pool. And then also, we're not sure what the public's gonna think of this, but looking at some different operations for the road where City Hall comes out onto Broadway, because Broadway's got a curve there, it can be really hard to turn left. We are looking at lighting as well, but the city staff was interested in, you know, what if you made that turn? I think it's one way, basically. I think we're looking at one way just in, so then it just wouldn't be an issue turning left out of there. And then trying to incorporate some of the past planning work that's been done where, you know, to better connect residents in Watervliet to the waterfront without having to go past those 787 on and off ramps. So they could just kind of get over 787 somehow. I think one of the more recent things that's been talked about is a tunnel under 787. So we're just kind of very generically referencing that, but then showing an improved crossing over Broadway, so it would be safer for people. So the tunnel wouldn't include Broadway, you would go under Broadway, you would cross Broadway and then go under 787. So it's trying to incorporate that So that's kind of the highlights of,
I'll just let you know that, I believe the upcoming studio class that Kate Maynard is teaching in
Okay.
Albany is looking at some sort of corridor in Watervliet. I believe,
you don't know which corridor?
don't know.
Okay, I'll talk to her.
Okay. And is that Broadway where the cycle track is?
So the cycle track is much longer,
Yeah.
but yeah, it does, no. That, I think right there, it might be an off-road, it's like,
It like switches back and
Off.
forth, it's like raised for a little while, and then it's just a striped buffer. Like by the McDonald's, I'm pretty sure it's just on road there, but it switches back and forth.
yeah,
I was on it yesterday. So, yeah,
okay.
I think, yeah, no.
Why do you ask about the cycle track?
I just was curious if I was thinking of the same roadway.
It's definitely the same roadway.
Yeah.
Yeah. But it does. It's not the same exact treatment on the whole thing from when you come out where the parking lot is by the river to go up to. Whatever road that is that goes over to Great Island.
Right.
And then otherwise, our planning committee meeting Wednesday morning, we have on the agenda to approve a Vision Zero policy statement for the region, which is looking at 0 fatalities by 2050 and a 50% reduction in serious injuries by 2050. And then also to release the overall draft plan for public review. So then we'll have, it's actually up on our website with the meeting materials for the Wednesday morning meeting. That will be kind of officially publicly released after the meeting for public comment on that as well.
What time is the virtual public meeting for Watervliet, tomorrow?
5:30.
That's it.
Yep. 5:30, and there should be a link on the website. I think you do have to register, so they'll send the link to join. It's a webinar, I think. Okay, the last update that I had was related to our long range plan, our metropolitan transportation plan in motion, the plan to 2050 is the name of it. So that is on the same schedule as Vision Zero in that it will be on our Wednesday morning planning committee meeting to be released for public review also. And then on August 7th, which is Thursday, we're having a virtual webinar from noon to 1. And then on August 12th, there will be an open house at the Delaware branch of the Albany Public Library from 4 to 6 p.m. But written comments will be accepted through September 3rd. And then that's just the day before the policy board meets. And that's when we will be asking them to formally adopt the plan, at which point it will be our new long range transportation. The website for that is inmotionplan.org. And the last thing that we have on the agenda is news around the table. So maybe we can go the other way around the table, start off with Region 1 over here.
Yeah, nothing that comes to mind really in mind. I would say, I forgot to mention it for Broadway, I would just, there's also the Broadway multimodal resiliency study.
Yes.
Going, okay, yeah.
Yeah, our consultants working on this project had been involved in
Okay,
that.
yeah, I just wanted to make sure. 'cause
Yeah,
that
we were,
was
yes,
expensive.
yes.
Yeah, nothing I could.
No.
You got anything?
No, I'm good.
Martin,
Nothing.
okay. Mark,
We'll be updating some of our housing reports that we did last year with more current data. In the coming weeks, so be on the lookout for our data news e-newsletter.
is that like what housing has been constructed?
No, that's like who lives in housing and how much housing costs, housing affordability, based on area median income for renters and owners.
Thank you.
Yeah.
Jonathan? Okay, online, Michelle, is there any updates you have for us?
Nothing at this time.
Okay, thank you. And Stephen, anything else?
I don't have anything specific unless anyone has any questions, but yeah, that's it for me.
Thank you. And then Leah, Adam, Ethan?
Nope, nothing from my end.
Okay,
Nothing from me.
thank you. Leah, did you get everything that you need in terms of attendance?
I believe I did. Everyone said their name, so that's great. So I can listen to the recording if I need to recall a name. Thank you, everyone.
All right, well, I apologize for our lack of discussion about the impact from the federal funding. So, you know, I can contact Katie, but we had a couple other ideas of people who could discuss. I think AARP is working on something. They NASH at the national level. They didn't have anything at the regional level that they were able to come share with us. And there was one other idea that someone had suggested to us. Another topic that we've been looking at is kind of alternative funding sources or like foundations. So if you do have any ideas of people or organizations that could speak to that for us, please let me know, because I've, been having a hard time. Yeah, finding somebody who could speak to that. Otherwise, thank you for joining and have a good rest of your afternoon.
Thanks.